Welcome to Lexcura Clinical Insights, the podcast where clinical evidence, healthcare standards, and litigation strategy come together. I'm Michelle Carroll, founder and chief clinical strategist of Lexcura Summit. Hospital-acquired infections, including CLA, BSI, CAUTI, surgical site infections, and C. difficile, can cause devastating harm. Yet the records often reveal whether established prevention measures were followed. These cases are governed by overlapping clinical, regulatory, and institutional requirements. The CDC's National Healthcare Safety Network, CMS conditions of participation, Joint Commission standards, and the hospital's own infection control policies help establish the compliance baseline. When an infection occurs, and the documentation shows missed precautions, device management failures, delayed recognition, or deviation from policy, the record may support both clinical negligence and regulatory non-compliance. In this episode, I will explain how to analyze infection control records, identify protocol deviations, and build the liability and causation analysis around the hospital-acquired infection. Okay, so here's something to think about. Every year, nearly 100,000 people in the US die from infections they didn't have when they walked into the hospital. That's more than car accidents, breast cancer, or diabetes. Today, we're talking about healthcare-associated infections, or HAIs, and how they're not just a medical issue, but often a legal and ethical one too.
That's a staggering number. And what's even more troubling is that so many of these infections are preventable. It raises the question, when does an HAI stop being just an unfortunate event and start being an example of negligence?
Exactly. And to answer that, we need to look at the standards set by organizations like the CDC, CMS, and the Joint Commission. These groups define what's considered acceptable practice in infection control. And when those standards aren't met, it can lead to serious consequences.
Right, and it's not just about lawsuits or financial penalties. There's also the moral obligation healthcare providers have to protect their patients. When something preventable like an HAI happens, it's not just a failure of protocol, it's a failure of trust.
Couldn't agree more. So let's start with the basics. HAIs are infections that patients acquire while receiving treatment for medical or surgical conditions. They're not present at the time of admission, which means they're directly tied to the care environment.
And they're surprisingly common. According to the CDC, there are about 1.7 million HAIs in U.S. hospitals every year. That's not just a statistic. It's a massive public health issue that costs the healthcare system billions of dollars annually.
And the human cost is even greater. These infections can lead to prolonged hospital stays, long-term health complications, and in some cases even death. What's frustrating is that many of these infections are entirely preventable.
So let's talk about prevention. The CDC, for example, provides evidence-based guidelines for preventing HAIs. These include everything from proper hand hygiene to the sterilization of medical equipment. And these aren't just suggestions. They're standards that healthcare providers are expected to follow.
The CMS, or Centers for Medicare and Medicaid Services, takes it a step further. They actually tie compliance with infection control standards to reimbursement. If a hospital has too many preventable infections, they can lose funding. It's a financial incentive to prioritize patient safety.
And then there's the Joint Commission, which accredits healthcare organizations. They conduct inspections and issue certifications based on a facility's adherence to infection control standards. Losing Joint Commission accreditation can be a huge blow. It affects everything from reputation to the ability to operate.
So, when you combine these three, CDC guidelines, CMS financial penalties, and Joint Commission accreditation, you get a pretty comprehensive framework for what's expected in terms of infection control. The problem is not every healthcare facility lives up to these standards.
And when they don't, that's when you start to see legal cases. For example, let's say a patient develops a surgical site infection because the operating room wasn't properly sterilized. If it can be proven that the hospital didn't follow established protocols, that's a clear case of negligence.
Absolutely. And the burden of proof often lies in showing that the healthcare provider deviated from the standard of care. That's where these guidelines and standards become critical. They set the baseline for what's considered reasonable and acceptable practice.
And it's not just about proving negligence after the fact. These standards also serve as a roadmap for prevention. Following them isn't just about avoiding lawsuits. It's about protecting patients and creating a culture of safety.
Right? But let's get into some specifics. The CDC, for instance, has a hand hygiene guideline that's been around for years. It's simple. Wash your hands before and after patient contact. Yet studies show that compliance with hand hygiene protocols is often below 50% in some healthcare settings.
That's shocking, isn't it? Something as basic as washing your hands can prevent so many infections, and yet it's still not universally practiced. It just goes to show that even the best guidelines are useless if they're not followed.
Exactly. And then there are more complex protocols, like those for central line-associated bloodstream infections, or CLABSIs. These involve multiple steps, like using sterile drapes and ensuring proper insertion techniques. The CDC has detailed checklists for these procedures, and when they're followed, the rates of CLABSIs drop dramatically.
But when they're not followed, the consequences can be severe. A single CLABSI can lead to sepsis, organ failure, and even death. And again, if it's preventable, it's not just a tragedy, it's a failure of the system.
And that's where the legal implications come in. If a patient can show that their infection was the result of a healthcare provider's failure to follow established protocols, they have a strong case for negligence. And the standards set by the CDC, CMS, and the Joint Commission are often used as evidence in these cases.
It's also worth noting that these standards are constantly evolving. For example, the Joint Commission updates its infection control requirements regularly to reflect new research and emerging threats. Healthcare providers have to stay up to date, and failing to do so can be considered negligence in itself.
That's a great point. And it's not just about keeping up with new guidelines. It's about implementing them effectively. Training, monitoring, and accountability are all crucial. If a hospital has great policies on paper but doesn't enforce them, they're still falling short.
And enforcement is key. Take the CMS, for instance. They've implemented a policy where certain HAIs are considered never events. That means they're so preventable that they should never occur. If a hospital has a high rate of these infections, they can face financial penalties.
And those penalties can be steep. For example, hospitals with high rates of HAIs can lose a percentage of their Medicare reimbursements. It's a way of holding them accountable, but it also underscores the importance of prevention.
Absolutely. And prevention is really the heart of this issue. The goal isn't just to avoid lawsuits or financial penalties, it's to create an environment where patients can receive care without fear of acquiring an infection.
And that brings us back to the moral obligation we talked about earlier. Healthcare providers have a duty to do no harm. When preventable infections occur, it's not just a failure of protocol, it's a failure of that fundamental duty.
So, to wrap this up, HAIs are a serious issue with far-reaching implications. They're preventable, and when they occur as a result of negligence, they can lead to legal, financial, and ethical consequences. The standards set by the CDC, CMS, and the Joint Commission provide a roadmap for prevention, but it's up to healthcare providers to follow them.
Exactly. And for patients, it's important to be informed. Don't be afraid to ask questions about infection control practices. Your health and safety are worth it.
Couldn't agree more. Thanks for tuning in, and we'll catch you next time.
Thank you for listening to Lex Cura Clinical Insights. A hospital-acquired infection case should not begin and end with the diagnosis. The analysis must reconstruct the patient's exposure, the preventive measures required, the care actually delivered, and the clinical response once signs of infection appeared. That means reviewing device insertion records, maintenance documentation, nursing assessments, isolation precautions, laboratory and culture results, antibiotic timing, infection control surveillance, physician notifications, hospital policies, and any available quality or regulatory data. The key questions are whether the infection was reasonably preventable, whether required precautions were followed when the infection became identifiable, and whether delayed recognition or treatment worsened the outcome. When the same protocol failure appears in both the patient record and the governing standards, the case gains a stronger clinical and regulatory foundation. For more clinical intelligence, litigation analysis, and practical guidance, visit LexCura Summit at lexcurasummit.com. I'm Michelle Carroll. Thank you for joining me, and I'll see you in the next episode of LexCura Clinical Insights.